All right, this is Issues in Technology, take 47. My name is Micah Milan. I'm going to be presenting on current issues in medical technology today. Um, Before we dive into the problems of technology, we do have to acknowledge the rewards that technology has brought to us. In the past decade, we've seen great leaps and bounds in what we can do and what we have available to us in medicine. We've seen the Human Genome Project completion, advances in stem cell research, targeted cancer treatments, and even as far as emergence of bionic limbs. The results of this technology, or the use of this technology, has led to a huge decrease in mortality rates, both in adults and infant populations. We've seen the better prevention and control of HIV/AIDS, where you're seeing people not even advancing to the AIDS stage. We can keep it in remission and have them well controlled by just being HIV positive. We've seen decreases in vaccine preventable diseases, not only by using the old technology of vaccination, but new technology or data management of um, finding or accessing at-risk populations like the elderly, like the youth, and getting those technologies to them, or the vaccines to them. Another big thing that we have now is trauma within America is now within the top 5 causes of death, which is a huge advancement. That means that we're better able to take care of some of the other traditional forms of mortality, such as heart rate, or heart disease, cancers, diabetes. So now getting into issues with medical technology, just a quick overview. I'm going to go over 3 physical dangers and then 2 troubling trends that we see right now as a result of medical technology and where it's taken us and where it's going. The 2 being the increased medical and insurance costs that are passed on to the patients, and the emergence of the eye-patient, which is what I'll go over here in a little bit. First and foremost, though, I want to go over the top 3 physical dangers of utilizing medical technology.
Everybody makes mistakes, even doctors.
I forgot to say clear.
The 3 that I'm going to touch on are alarm fatigue, exposure, and infusion pump input errors. If you're not familiar with these, I'm going to go over them quite shortly. First and foremost, the number 1 cause of injury or death with use of technology is alarm fatigue. Technically speaking, it's a form of sensory overload in which clinicians are exposed to an excessive number of alarms. What happens is they've got 30 alarms going off at the same time, and as a result of this, they're being desensitized to the alarms, so they're missing them or not paying attention to the correct or prioritizing the correct alarms. This can have a great impact on patient outcomes, not only just life or death, but how long they're in the hospital or how much tissue is impacted with responding to alarms, whether it's oxygen levels or glucose levels. The second one is exposure. This one is interesting because it affects both the patient and the provider. The use of X-ray imaging and nuclear medicine today exposes physicians and patients alike to hazardous materials. The amount and frequency of exposure is directly related to negative side effects. So the more exposure you have to these X-rays, the greater the chance you're going to have the problems associated with them, such as soft tissue cancers. These side effects range in severity anywhere from simple hair loss to infertility and cancer of, like I said, exposed tissue. The third one is infusion pump input errors. Now, for those of you who don't know what an infusion pump is, it's a medical device that delivers fluids such as nutrients and medications into a patient's body in controlled amounts. So essentially you can set it, and I don't want to say forget it, but it will give the right amount at the right time if the data is put in correctly. The problem with that is small mistakes can have huge ramifications for the patient. the type of input errors that you're seeing are entering wrong numbers or incorrect use of decimal places. So as you can see on the left, that's a typical infusion pump. You don't have a keypad with numbers on it. You're constantly pushing up, down, left, right to get the right digits. It's very easy to make a mistake. And even a small difference can make a huge change in this as well. Let's say you give 1.0 milligrams of a medication instead of 0.01. If it's nitroglycerin, that could be life-threatening to a patient. So the second problem that I'm going to go over is not so much a physical danger, it's more of a trend that we have seen that we are going to have to probably figure out how to control in the future. If you look at the medical cost projections, you can see on the left in the graph, it's the projections of national health expenditures and their share of gross domestic product. Up until 2017, it's raising at a fairly high rate. It's going to be projected to be about 6.2 per year from 2015 through 2022. If you compare this to the interest rate in the US, it's more than double that. So it's something that we really have to address. Overall health spending is projected to be about 19.9 or 20% of GDP by 2022. It's almost a fifth of what everybody's spending is going towards health-related costs. In certain studies, they found that new or increased use of medical technology contributes right around 40 to 50% to this annual cost increase. Some of these increased costs associated with medical technology include the production costs of machinery and material, the production costs of medications, the cost of training and utilization of specialists. Oops, I'll go back there real quick. If you take a look at especially in terms of medication, I mean, maybe you've seen in the news the new hepatitis C vaccine that has come out cost about $1,000 a pill. That's wholesaler price. It's not with insurance, although insurances a lot of times are not paying it. In terms of specialty or specialists, what we're finding is, take for instance radiologists. The average radiologist salary is $135,000 a year. That's just the average, and that's one of the higher salaries. But it costs money to utilize them, it costs money to train them, and that's all passed on to the patient. We're also seeing an overuse of technology. Just the mere existence and availability of technology tends to increase its use regardless of its necessity. This is often used by practitioners in order to protect themselves from possible malpractice lawsuits. So if you take, for instance, the pictures on the left, you technically could diagnose pneumonia by auscultating lung sounds and taking a complete medical history. But if an insurance company comes at you and says, well, why didn't you take an x-ray, which would allow you to physically see the pneumonia and the extent of pneumonia, which would help guide treatment, it's hard to, it's nice to have that backup in terms of legal issues. But once again, the cost is pushed onto the patient. The last issue that I want to cover is what a lot of providers are referring to as the emergence of the eye patient. It has nothing really technically to do with an Apple product, but a lot of times you hear the phrase in the field now thrown around that says, treat the patient, not the monitor. So essentially what you're having is this physical construct of the patient represented in data or checklists or imaging, and it refers, well, eye patient refers to the increasing tendency of practitioners to focus heavily on this diagnostic data, which merely represents the patient while neglecting to spend actual time with the physical patient. The problems with this is it increases the number, the cause of this is the increases in the number of diagnostic tools available, which can lead doctors to formulate a diagnosis even before seeing a patient. So psychology has shown us that once your mind is made up, it's actually quite hard to change it, even if you're given different possibilities or more input that would lead you to think something else. So the doctor comes in, and before he actually talks to the patient, he's seeing the x-ray, the MRI, the med history, which was taken by somebody else, and he's formulating his diagnosis off of that and not through interaction with the patient. Neglecting to visualize, auscultate, and palpate can lead to missed signs and symptoms. So in terms of visualizing, obviously you're seeing, auscultate, you're listening to, and palpating, you're feeling the patient, what is wrong with them, and determining what kind of disease process is happening. Without doing so, you can actually miss quite a few things. Soft tissue hardening might not show up on certain x-rays or CT scans that could be easily picked up by simply feeling the area in question. And I think a lot of things are being missed because of this, because of the use or overuse or overdependence on this new medical technology. Another interesting thing that's happening is a decrease in person-to-person interaction, which undermines the doctor-patient relationship. It's very hard to get a patient to be compliant with his medication or treatment regimen when you only see him for 30 seconds and you're pretty much like a faceless cog in the system. If you take the time to sit and talk and learn about your patient, that trust is built up over time, and the more likely they are to do what you tell them to do, which is good for both parties. Not only the patient in terms of health, but the doctor in terms of success rates and treatment. So I really like this quote because it says, all progress is precarious, and the solution of one problem brings us face to face with another problem. I think the introduction and utilization of medical technology is going to be like this no matter what. You know, we can reap great benefits from it, but we always have to be aware of some of the pitfalls or the issues that it may cause. And having said that, like I said before, I mean, we have come a long way. We can do so much stuff with the new medical technology that is available to us. We just have to be aware of its limitations. So thank you for listening, and I hope you enjoyed the semester and presentation.